Hi, everyone. Good afternoon. I think we'll get started now. We have a decent number of people joining us. Thank you for being with us today for this webinar on mental health in the workplace, which is part of our BVI Mental Health and Psychosocial Support webinar series. So this series is part of a project between the government of the British Virgin Islands and the Pan American Health Organization, PAHO, on mental health and psychosocial support and building individual and community resilience in the face of disasters. So as I mentioned, today's webinar is on mental health in the workplace. We have two presenters with us. We have Dr. Jardine Torno, a psychiatrist for the BVI Health Services Authority, as well as Dr. Sidra Kadir, who is a resident of psychiatry at Georgetown University Hospital and also works with us at the Pan American Health Organization. My name is Amy Tausch. I work at PAHO, and I'd also like to introduce my colleague, Dr. Claudina Cayetano, who is the regional advisor on mental health at the Pan American Health Organization, and she will be helping to co-facilitate this webinar today. So before we get started, I just wanted to let you know that we will have two presentations. We will save all questions till the end. We'll have about ideally 10 to 15 minutes for question and answer and discussion. And also to let you know and ask for you to hopefully help us, we'll be sending out a short questionnaire after the webinar to where you can evaluate the quality of this webinar as well as other things. And so we'd greatly appreciate your helping us to improve this webinar series by participating in this brief survey, which will automatically be sent to you as soon as the webinar ends. So without further ado, I'll present our first presenter, Dr. Torno. Dr. Torno, are you with us?
Yes, hello, good afternoon. Can you hear me?
Yes, we can hear you well. Thank you.
All right, so good afternoon, everyone. My lecture today is about managing stress at work. I know in the authority and since the start of COVID that we have been, experiencing a lot of changes and unpredictability when it comes to work and our personal life as well. With all the different lockdowns and all the different curfews that we are having, sometimes it's very difficult to put the boundaries between personal life and work because most of us has ended up working at home. So I hope that this lecture, next slide please, will help us learn about work-related stress and identify factors that contributes to it and learn strategies for managing stress at the workplace. Next slide. So from the very beginning of the PAHO webinar series, we have been talking about stress, and we have all have a good idea of stress, but I just want to emphasize that stress is technically not a disease. Stress is not also a diagnosis. It's a condition or feeling that we feel and everyone experiences when our perception of the demands exceeds our personal and social resources. And as we all know, our body triggers a series of physiological responses to stress, and that would include the fight and flight reflexes or response, which I'm not going to go through in depth for now. Next slide. Now, with regards to workplace stress, this is a series of harmful physical and emotional responses that occur when the requirements of the job do not match the capabilities, resources, or the needs of the workers. So there are different sources of workplace stress that we're going to be dealing with later on. Next slide. So all of us need our job, and I'm sure all of us are passionate in doing our job, and any job that is worth doing at times would involve a certain amount of pressure, and it is this pressure that is sometimes needed for us to meet deadlines and produce good results. So having said that, pressure can be good if it provides stimulation and motivation, although there are certain instances that it leads to problematic outcomes, especially when the pressure has been chronic and too much for our coping mechanisms. Also, a work without too much pressure can also be stressful in a way that it doesn't stimulate learning or stimulate motivation. Next slide. So, what are the usual causes of stress at work? First and foremost is the physical environment. And when I say physical environment, it includes physical structure of the building, the space, the lighting, the safety. So, for example, if the space is moldy or the space is uh, not well lighted, then it can cause problems at work. The second is the job itself, the nature of the work. If it's like high, it needs high demands, or if you're given low salary, or if you're given excessive workload. Interpersonal relationship with your boss, your manager, or your co-employee. Major change, major change in work demands, um, having been promoted, given more tasks than you are currently able to do, change in the schedule, and change in environment. Um, and lastly is change in personal circumstances. If we are experiencing problems with relationship or with the marriage, or if you just given birth, or you're having like um, some issues with your families or your relatives. Um, so those are what I'm talking about when we say the change in personal circumstances. Next slide. But with the COVID-19 beginning in March, there are also additional sources of work stress that we are experiencing. This includes uncertainty about the future of our job or our employment, especially nowadays. A lot of people have been, working less hours, and people have been cut off from their work because, like for example, in the tourism industry, there's, in the BVI, our borders are not yet open for the tourists, so most of the hotels and the yachting industries are not operational. So even when you think that your work is not affected, you still have this uncertainty about the future because we don't have a clear view of the economic situation uh, a few months from now, or even what what if there's another COVID positive person coming into the island, or there's another breakout of infection. Now we also worry about coming to work, or the possibility of catching the illness and bring it back to the family. There's also feelings of isolation because of the lockdowns and the curfews. We're not able to like see our friends, hang out with our friends in person, and if you live alone, that's also a problem because the usual coping mechanisms that you might be able to use, like exercising outside, going out for dinner or like for a walk, you're not able to do it because of the lockdowns and the curfews. Now, because most of us also works from home, we find it stressful as well to take care of our personal and family needs while working. Because, for example, if you have children, the children are also doing online schooling at home, and you're doing your work at home too. So it's basically like you have to like put up some boundaries when it comes to you as a parent, you as a worker, and you as a person, because sometimes the boundaries can be blurred because you're working in one place. Managing a different workload because you know since the COVID, we have to learn new technology. Like not everyone is adept in working at home, um, but now everyone should be mindful about like how to utilize the computer, how to do the WebEx, doing seminars online. So these are all things that are new to us, and these are things that we need to learn, um, and we need to like be good at, especially if your work involves a lot of technicalities surrounding it. Um, Adapting to the different workspace and schedule, as I've said, working from home, sometimes we blur the lines of like having to rest at the house and working at the house at the same time. Next slide. Um, I just put it in my slide because there was a study made about how people perceive the stress with work in addition to the COVID pandemic. And the study showed that for people that are aged 30 to 59, they have an additional worry about catching COVID or becoming seriously ill from it, primarily because they're on the high risk population. Next slide, please. Now, as healthcare workers, we also face additional stress. Um, Aside from the ones that I mentioned, because we are on a higher risk for getting the infection because we work in the environment. So we always have this feeling of under pressure, which is quite normal given the circumstances. And we have to remember that stress and the feelings associated while working in this kind of environment are not signs of weakness or inability to do your job, because we have to normalize the feeling that when we go to work, there's always a risk that we will you know be exposed and probably give it to our loved ones when we get to the house. So there's always that thought at the back of our mind. And also sometimes there's also stress because we have to make sure that we learn new skills like how to dock and put on and put off your PPEs. We also have to learn additional skills in terms of swabbing. We also always have to remember to sanitize and all of those things. So even though your work is not too clinical, if your work is administrative in the hospital, you still have to be aware of all those things, and sometimes it's an additional things to worry about aside from your work. Next slide. Now, having said the factors that contributes to stress, it's also important that you yourself be able to know and identify when the stress is too much or when you're having stress reaction. So these are feelings of irritation, anger, or denial, feeling uncertain, anxious, or nervous. Notice yourself having lack of motivation, getting tired easily, and overwhelmed. Sometimes you have feelings of sadness and depression, and these things affect your sleeping habits and your focusing and attention. Um, as we all know from our previous lectures from stress, stress affects the entirety of our body. It affects our mind, our body, our emotions, and even our behaviors. Next slide. Now, chronic stress can result in anxiety, depression. It can result in insomnia, and it can also affect physical illnesses like obesity. It can raise your blood pressure, your cholesterol, and it can weaken your immune system. Compounding these problems are, some people deal with stress in a negative way, such as overeating, unhealthy diet like snacking, um, smoking, or abuse of drugs and alcohol. Next slide. Now, how do we manage stress at work? What I did with my slides is I divided it into three ways, for which I would have some tips for the managers, would have some tips for you as a coworker, and for yourself. So let's start with managing stress for the managers first. So we have said that, you know, we have given the symptoms or the stress reactions that we need to look for our employees. Um, for the managers, if you see an employee that is lacking motivation, if there is a change in their usual work pattern, if you see them like not caring or not being committed too much at work, uh, coming in late for work, or like becoming absent or increased absenteeism, those are like red flags that we need to entertain. All right. So we have to, for the managers, we have to make sure that we hold regular meetings and briefings to cover the current status of work. Now, because we work in silos, some of us works at home and some of us doesn't even see each other. We have to make sure that everyone is in the same place with regards to what the new protocol is, what the new policies are, or what problems are arising in the organization, and what are the plans that are there to solve it. We have to redefine the roles and reevaluate functions of some individuals in our service because of the different work changes. If there's additional work for an employee, or if there's an additional role that he has to play, then we have to make sure that we define the roles for the individuals and for the group so that everyone will be in the same pace and will be able to work together. Again, because we work in different setups, and we work from home, and sometimes we don't see each other, it is very important for managers to recognize accomplishments made by one person and be able to tell the group about that. It's also important that if there's any conflicts arising, that the managers will be able to resolve them quickly and as early as possible, so that to promote staff cohesiveness. Another way of managing stress at work is instituting a buddy system. So if the work is deemed stressful, then you can probably pair like an inexperienced worker to an experienced worker so that they can complement each other, or pair a more senior staff to a more junior staff. If applicable, if the work setup allows it, you can also rotate workers from high stress functions to low stress functions. Um, I'm not sure with the clinical staff how it can go, but maybe with the admin staff, you can, this might be a lot easier. Initiate, encourage, and monitor work breaks and implement a flexible work schedule to help the staff balance home and job responsibility. So as managers, we have to encourage people in taking their work breaks, and we have to make sure that we can give them, ideas on how they can utilize their work breaks more efficiently. If they're having problems at home because, their children are um, doing online studying, um, then we can probably help them, by giving them flexible work schedules so that they can ease the burden. We can ease their burden about taking care of their children and working at the same time. Next slide. It is also important for managers to listen to their staff's concern with sympathy and act accordingly. We have to be open as managers to feedback from or complaints or concerns from our staff and be able to diffuse it, accordingly. We have to make sure that we provide them with a safe environment to be able to raise their concerns without feeling judged or feeling ostracized. It is also important for managers to treat everyone fairly, and especially for frontline workers, it is important for them to have a safe place to work and to rest. In fact, there's a study when the COVID-19 was just starting. There's a study I read in China, in Wuhan, wherein their psychiatrist was asking the hospital staff what help do they need or what kind of training do they need, and the first thing that was given as a response is just to be able to be provided with a place to rest, a place to where they can relax and entertain themselves, like a quarters with food, TV. Those are the things that the staff asked for initially, to help them manage themselves during the crisis. The managers need to promote an atmosphere when attention to one's emotional state is acceptable and encouraged. This is what I'm saying. So when your staff approaches you, you have to make sure that you listen to them and to hold judgment and to make sure to make them comfortable in expressing their emotions and expressing their, you know, grievances at the same time. Um, the managers should be able to acknowledge that it is indeed a stressful situation and be able to connect the staff with professional help within or outside the organization. So in the BVI HSA, we have our occupational health headed by Dr. Trotman, and we also have our EAPs um, from the Human Resource Department. Next slide. Now, as a worker, it is not our responsibility to deal with our coworkers' issues. But, you know, if you notice a coworker having difficulties or having, you know, a lot of stress, and if you want to reach out and support one another, these are some things that you can do for your consideration. First and foremost, when all of us are different and all of us have our different ways of identifying and managing stress, and not everyone is able to accept that they are stressed and that they need help right away. So the first thing that you need to do is to explore the situation first. You might want to state your observation to your coworker, saying that, you know, for the past few days, I noticed that, you know, you're not as joyful as before, like you're not smiling and you're always, you know, serious. So you can start probably with that, and you can ask them, okay, is there something wrong, or is there something that you want to talk to me about? Now, when your coworkers respond to that, avoid making judgment or conclusion. So avoid saying that I think you're depressed. Do you need help? Or I think that you're having anxiety. So resist doing that, because some people, when you put labels right away, then they close up and they don't want to talk about it, because especially in the British Virgin Islands, you know, not a lot of people are open to like talking about seeing a psychiatrist or like a counselor. Um, so when you open the conversation with that right away, it might abruptly cause your coworker to clam up or not talk about, you know, his or her emotions freely. Now, also have to remember practicing active listening. So you have to make sure that you let the other person know that you're listening, and you know, you can make sudden gestures to know that you're still interested in listening. Now, lastly, for this part is hold on giving advice, instead ask what you can do to help. So most of the time, people doesn't want to be told what to do. So if you ask your coworkers, or here's what I think you should do, you can probably ask him instead that, you know, okay, what can I do to help, or is there anything that you need to, is there anything that you need? Next slide, please. Now, if your coworker is accepting that he is stressed and is ready for a change, which is a step higher than from the first one, what we can do is to help him maintain relationships at work and avoid necessary conflicts or acting out. Some people, when they get stressed, they become tactless and they can act impulsively. So we have to talk to our coworker about the behaviors that you notice, and make sure that, you know, he still respects authority, and you know, avoid unnecessary um, ar- arguments or unnecessary problems while at work. Again, as a coworker, you have to encourage, you know, you have to encourage them to take their breaks, and you may suggest relaxing or engaging activities to do while on their break. So when we have our work breaks, most of us, we spend it eating, because sometimes our work break is also our lunch break. But you can also like listen to music, read a nice book, or listen to a podcast, or you can just like, you know, do some walking and do some stretching. So those are ways that you can like maximize your work breaks. Teach your coworker to focus at one small step forward at a time. If he is overwhelmed at work, encourage him to list down all his tasks and assist him in planning and prioritizing those that are important. So a lot of us, because of this things that are happening, we are, you know, doing things at home, and we are, you know, doing more than one thing at the same time. So some of us are taking care of our children while doing our work. Some of us, are doing extra work because we need to. So we have to focus on which ones are important, and we have to make sure that we work on a schedule so that we don't get overwhelmed. It is also important to help him focus on solutions rather than problems. So instead of talking about the problems all the time, maybe we can teach our coworkers to okay, list down your problems, and then let's work on possible solutions, and then to look at the solutions first, and work towards it instead of just focusing on the problem. Now, if you feel like what your coworkers is experiencing is beyond the help that you can give, you can encourage him to seek additional support, again, within or outside the organization. Next slide. Now, for ourselves, it is also very important we identify our own stress, and it's also very important that we will be able to identify if we are dealing well with, stressful situations or not. So, first and foremost, we have to identify things that are making us stressed. And if we are able to identify it, then we have to, if we can, openly communicate it with our supervisor or manager. Talk openly about how the current crisis, the pandemic, has been affecting you and what their expectations of you at work are. So, for example, because we have been working at home or we are seldom asked to go into the hospital, you can talk to your supervisor or your manager and ask them, okay, what what am I required to do while at home? What are changes in my job responsibilities? How often do I need to go to the hospital? Or what kind of things, output do you want from me? Focus on working solutions rather than the problem, and identify things that you have no control over. Increase your sense of control by pacing yourself and developing a consistent daily routine as possible. As I've said, we have to pace ourselves in order for us to be able to focus on a certain task and not get overwhelmed. Next slide. Now, as an individual experiencing this situations, we have to make sure that we take care of our body. So we have to maintain regular sleep schedule, and if we are working from home, take breaks from work to stretch or exercise, and or to check in with our colleagues and friends. If we can, spend time outdoors, either by just relaxing or being physically active. Schedule is very important, so that we need to set a regular time to start our work and end when working from home. This will help us put boundaries on the different tasks that we need to do, especially when working from home. So if you're able to set a start time and an end time while working at home, you'll be able to give more time to do the things like household chores, or helping your children with the assignment, or cleaning the house, or like doing your groceries, so that there is no blurring of the responsibilities that you need to do. I'll give you an example, like for example, teleconsultation. Sometimes initially it was very hard for me to do the teleconsultation because the clients that I have were able to contact me even late in the night time. So initially, I was entertaining them even like after office hours, but there came a point wherein I got so stressed, so I decided to just do the consultation as a certain period of time. And if ever they do message me after working hours, I'll probably like message them that I'll get back to you in the morning if I feel like it's not an emergency. So having that kind of balance helped me to be able to like give myself some time to take a break from work and to also like do something else that is more relaxing for me. Next slide. Next slide, please. Yeah. So we have to remember the reason why I said, the example that I gave is we have to remember that we have to be compassionate to ourselves. And, we have to remind ourselves of our duty to ourselves as well, you know, that we have to make sure that we are well so that we can continue to be able to help other people as well. In times of like when there are times that we feel like giving up, we have to remember that we are not alone in this situation, and that everyone is in the same boat. Everyone is experiencing the pandemic. A lot of us are working from home and at the hospital. Um, so we have to remember that so that we don't feel isolated or we don't feel like it's only our burden to carry. To carry. Connect with others. It's very important that we maintain connections um, with other people, family, friends, loved ones, either through social media or through telephone communications. Um, Keep a balanced perspective by challenging all or nothing thoughts. When you feel like your thoughts are becoming negative all the time and you generalizing things, then we have to start challenging them. Um, focus on our positive coping skills that has worked for us in the past. So before COVID-19, we had Irma and Maria, and if we use our coping skills during that time, we harness them. I'm sure that they can still be effective this time around with the COVID. Now, what you can also do is seek at least three good things each day. What I tell my clients is usually I advise them to maybe start their day with a positive affirmation or an intention that today is going to be a good day. I'm going to do my job well. I'm going to interact with people in this way. And then at the end of the day, I always ask them to look at three things that are good during the day or that that they are grateful of. So having that kind of perspective during the start of the day and also ending your day in a positive perspective would also help, with your mindset. And also practice mindfulness and relaxation techniques. This is a good way of managing your anxieties and helping you be more calm and relaxed. There are other ways of dealing with stress like meditation, praying, aromatherapy, music. Um, you can also do some exercise and getting a new hobby. So those are things that can help you deal with some symptoms of chronic stress. Next slide. Now, uh, these last few slides, I want to focus on some relaxation techniques that we can utilize on our break or at home. These are very simple to help you manage your anxiety. Of course, the very basic one is taking a deep breath. Next slide. So the deep breathing technique um, is one of the most common ways. I'm sure every one of us are aware about this. Um, you know, this is very helpful in managing, shortness of breath or bringing down your heart rate. And how to do it is, get into a comfortable position and then start breathing in through your nose, filling your belly in with air. So when you breathe in, you would feel your chest and your belly expanding. And I want you, to as you breathe in, focus on the warm air coming in, and then slowly breathe out through your nose. What you want to do is to make it, a long, deep breath. And to make it easier is for you to maybe use 5 counts, going in, breathing in for 5 counts, and exhaling for 5 counts. Next slide. Now, an additional way of doing the deep breathing is with breath focus. So, again, close your eyes and be comfortable. And as you breathe in, what you want to do is um, focus on the air coming in your lungs and think about how it brings peace and calmness through your body. So if I'm doing it, I would take a deep breath, and I would say I'm breathing in peace and calmness. And as I exhale, I would say I'm exhaling or I'm breathing out stress and tension. And you may want to do this for about 10 minutes in a quiet place, 10 to 15 minutes. And you may want to do it regularly so that your body gets used to it. Next slide. Another way, which is my favorite, is the lion's breath. So this is a form of breathing exercises wherein as you exhale, you say or you breathe out a ha sound. So you can't see me, but I'm sure you're going to be able to hear me. So I'm going to breathe into my nose, filling my belly and my chest with air. And then as I breathe out, I would say, ha! So that would expel nervous tension and, um, help you with the anxiety as well. Of course, because it's a pandemic, you should do it with proper distance from another person, or you should do it alone. Next slide. Next one is mindfulness. Mindfulness is a state of active and open attention to the present. It's being able to observe, your own thoughts and feelings without judgment, and also being aware of the environment. Next slide. So there are different types of mindfulness exercises, but the one that I use most commonly is the conscious observation. So you can do it with your eyes closed or your eyes open. With your eyes closed, you're gonna have to use your imagination, of course, and then you start with taking deep breaths and taking your mind to your favorite place. So if I'm gonna be doing it, I'm gonna close my eyes, take deep breaths, do the deep breathing technique. I'm gonna probably imagine the beach, and once I'm there, I'm gonna focus on the surroundings. So what we want is to be able to describe the surroundings, either using five things you see, the 5, 4, 3, 2, 1 technique, as I call it. Five things you see, four things you feel, three things you hear, two things you smell, and one thing you taste. So I would describe my scenery in my imagination. So I'm looking at the blue skies, and the water is also blue. The plants are very lush and green, and I see the sand is very white and sparkling. And I would like to touch the sand because I want to feel it, and I feel the sand very fine and powdery in my hand. I want to go to the water and wade in it, and it's just the right temperature. It's warm, and I'm smelling the breeze of the air, and the taste of salt in the air as well. So that's how I want to do my conscious observation. You can also do it with your eyes open. For example, if you're in the office and you're having a stressful time and you just want to take a break. So what I usually do for that is I'm going to focus on one object in my table. For example, right now I have in front of me a vase. So I'll try to focus on the vase and describe it as thoroughly as I can. So in this way, your mind focus on what is happening, and distract yourself from the other thoughts that are anxiety provoking. So this exercise you can do almost with whatever you're doing. When you're taking a bath, you can still do mindfulness by just experiencing the water flowing from your head to your body, the temperature of the water, how it touches your skin, or even having breakfast. You can be mindful while having breakfast. You just focus on you know how the food texture is in your mouth, the taste, the smell of the food. So that's already a way of being doing mindfulness through conscious observation. Next slide. Now, as I've said, we have to be able to identify stress because we have to be able to manage stress early in our lives to prevent chronic the chronic outcomes of stress. So these are the summary of the ways wherein you can also help yourself manage your stress. Thank you very much. Next slide. Now, if you feel like you've done all of those things and you still need help, these are the numbers that you can contact. So we have there the numbers of our own service, which is Community Mental Health and Substance Abuse. So it's going to be me and Dr. Rubain, and of course the Behavioral Health Service, which is by Dr. Samuels, and all the other private practitioners and services in the island are there too. So you have the 5 doctors medical and wellness, the wellness center, therapy to thrive, and family support. Next slide. And these are the resources that I have used for this presentation. Thank you very much. I think that's the end.
Thank you so much, Dr. Torno. And if it's all right with you, are we able to share this presentation with our participants?
Yes, yes, you may.
Okay, wonderful. Thank you again. So now we'll go to our second presentation by Dr. Kadir. And I think before Dr. Kadir starts her presentation, Dr. Cayetano wanted to ask a few questions.
Sure.
Oh, I'm sorry. I think to the participants. We'll save the questions for presenters until the very end, if that's okay with you.
Yeah. No, thank you very much, Amy, and thanks, Dr. Turner. This was a great presentation. So we'll save the question for the end. I just wanted to appreciate the fact that Dr. Rubain and her colleagues, including Dr. Samuel, selected this topic because I think it's such a relevant topic, especially now. We tend to spend more than, when you're at work, you spend sometimes 30, 40 hours at work. So your mental health matters. So I want to encourage you to start to, type your questions. I know that the tips that Dr. Turner presented, you'll be able to do that on your own, but type your question in terms of, are we really paying attention to make sure that mental health is recognized in the workplace? If someone has a mental health problem, are we comfortable to talk to our supervisors about that? And how is that being addressed in your settings? I think those are the things that we want you to take, from this presentation. So because of time, I will stop here. I'm just encouraging you to, to think of what questions you want to address that will matter most to you. In 2017, we had a World Mental Health Day, which was the theme was mental health at workplace. So because we do, from PAHO, we do value this topic. By the way, this year for World Mental Health Day, the topic is investing in mental health. Again, emphasizing the importance of mental health. So with further ado, I want to introduce my colleague. So go ahead, Dr. Sidra. Thank you.
Thank you so much, Dr. Cayetano. That's much appreciated. And also thank you to Amy and Dr. Torno. That was a very good presentation. I think we covered a lot of ground, and I'm acutely aware of the time limitation that we are working with. So I'm just going to quickly move through the presentation so that we can have as much time at the end for the questions, which I think is a more important piece of it because we've already talked about it, many different concepts. So before we really delve into it, right now we are living through a time of unpredictability, and we as humans, we don't like or prefer unpredictability in the workspace. Like, it's uncertain. How is the workday going to look like tomorrow? What space I'm going to be using? Where I'm going to be working? What are my hours like? And this is something which we all have experienced at an individual personal level as well as at the level of an organization. So we don't like that as humans, and that adds on to the stress of the work itself. And just acknowledging that this is not normal. This is a different situation than what I'm used to. This will revert back to somewhat of a normalcy at some point. Just acknowledging that, I think, is the first step in understanding that we are living under an added stress. And just accepting that, acknowledging that, and also acknowledging the fact that people who are working around us, they are also going through the same experience. Like they also are experiencing an added level of stress, which can spill into our relationships as coworkers. And we all have experienced this. Like I personally have experienced this, that there are days that are just they're not the same as before. Or the amount of work that I'm doing, I would be able to do that way more comfortably when the COVID situation hadn't happened. And now that takes more energy, that takes more attention, that takes more time, because we are all living with this added burden. And when we talk about a workplace stress and stigma, this is a real thing. There is a lot of research going on around understanding how we can manage it, mitigate it, and work around it, because work itself, workplace is a stressful environment. We have certain goals and objectives, and we are all working towards achieving those goals. So it's a high stress environment to begin with. And when you add on to that the pressure of living in a pandemic in which there is a fear of actually contracting an illness, which can be very dangerous, we have our kids at home who are not going to school, who we are managing and working with, and then we have other people to take care of. And on top of that, we are all professionals and we work in a field in which we try to do our best and beyond. So this is a recipe for a high stress burnout. And just acknowledging that, being aware of it, I think there's a lot of evidence and there's a lot of research going on around the world right now that we are going to have repercussions to it and how to mitigate that. Just walking through it, I think we can move on to the next slide. And absenteeism, like not being able to get to work, and presenteeism, like you're at work, but you're not feeling your best, but you don't want to take the day off for many number of reasons. And how does that impact your productivity at work? And then the disability claims, injuries and illnesses, grievances, turnover, legal implications. I did not want to stress too much on it because this can also feel like it's not normal to take a day off, while it's totally normal to take a day off. And it's in your favor and the favor of the organization that when you come to work, you are recuperated. You are able to perform at the best for that day. So all of these things can be perceived as, oh, is it not okay to report that you're not having, your work environment is not great? Or is it bad to somehow claim for disability? Or like, is turnover bad for us? So if I'm making myself clear, there can be two faces to this slide, that if you look at it from the perspective of an organization, it can feel like, oh, why are so many workers taking days off? From the point of view of a worker or an employee, it can feel like, well, this was the day that I just couldn't wake up and I couldn't get out of the bed and I'm having a hard time just managing kids at home. I need this day off. But at the end of the day, it is in the favor of both the organization and the employee to facilitate mental health, to accommodate mental health leaves or days off, or to consider mental health as a part of the overall health, in ensuring that when you're sitting at your desk, when you're trying to take care of a patient, you're able to focus and be there, present in the moment with your full capacity. I think it works. It can look like it can be detrimental to one party, but it is actually not. If we are able to ensure the mental health of the people who work with us and for us, then that's a better outcome for all of us overall. And moving on to the next slide, we're going to talk about depression and how it sort of is the most common disability causing burnout and then overall affecting the productivity of the organizations and managers and employers. So COVID-19, we talked about this already, a mental health friendly workplace. First of all, you need to know that this is a real issue. The workplace should facilitate your ability to talk about your concerns. It should not be judgmental. It should not be punitive. And it should not be discriminating. And if any of that is happening at the workplace, then there can be no positive outcome. There is going to be a detrimental outcome for everybody involved because you're not able to give your 100%. And then that leads to grievances. And there's like a whole spiral of negativity that generates from that. So making sure that the work environment is mental health friendly is in favor of everybody, including the employees and the employers. Moving on to the next slide, the strategies for this, we have talked about this in detail throughout this presentation. And the most important takeaway for the employers is to create a space which is safe and healthy and encouraging for the expression of the mental health care needs. We can move on to the next slide. And the employees, we've already talked about this. The important thing is that making sure that you have a structure in a day, making sure you're taking time for self-care, and making sure that you are aware of the resources that are available. And you're not alone in this. It's not your burden to carry for 100%. You can share that with other people, because how you feel, it is important not for you, not just for you, but also for other people, other coworkers, and your children. So we are not working in a vacuum. We are all interconnected and influence other people and how their day goes. Moving on to the next slide. Coworkers, we've already talked about this. Be a good listener. Just let them express if they want to tell you something about how they're feeling. And if they don't want to tell you something, then just give an impression that you're available for them. That is the only thing that we can do in a safe and protective manner to make sure that somebody feels comfortable just calling us or texting us or walking up to us and telling how they're feeling. Moving on to the next slide. So recognizing depression, as I said, depression is like the most common experience that we feel, or an outcome. Or I don't want to call it I don't want to give it a label of an illness, especially at this time when it is very hard to tell whether this is depression or just a burnout or an increased stress. But some of the things that you can look out for is if somebody looks or feels different to you, if they are not smiling as much, if they are not being present in the moment, if you feel that you talk to them and they just zone out, if their appearance is not the same, they don't dress the same, or they're not putting in an effort. So just being mindful of how the other person is looking to you and just walking up to them and saying, "Hi, are you doing okay? Can I help you somehow?" I think that can go a long way in creating an environment which is safe and protective. And we have only 4 minutes to go. So let's open it up for the questions.
Thank you so much, Dr. Kadir. So now what we'll do is we'll open it up for questions. If you are able to click the raise hand button, I will unmute your microphone so that you can speak. And I wanted to mention that we have over 50 people with us today, so that's a great participation.
If we don't have any questions, perhaps since we're running out of time, Amy, would you suggest that perhaps what we could do, we can ask Dr. Turner and Dr. Zero, our presenters, to maybe give us some, oh no, I see Althea. There's a hand from Althea, but I was going to ask if they could give us some takeaways for today's session. But you may want to
needed to, Althea.
Yeah. Go ahead, Althea.
Althea, are you there? We can't hear you. Oh, unfortunately, it does look like she might be having some technical problems. So maybe we do what Dr. Cayetano suggested in the meantime, that Drs. Torno and Kadir give us some key takeaway points. And if Althea comes back with her question, we can address it after.
Sherry Ann seems to be also having a question. Sherry Ann George Smith, Amy, maybe you can unmute her.
Sherry. Okay, Sherry Ann.
Yeah, I think I can read the comment that she has mentioned. It's very important to know your coworkers so you can facilitate, I'm sorry, just like screen is. If you could read that question, Amy. Yeah. So it's very important to know your coworkers so that it's easier to spot the challenges when they occur. And that's absolutely true. And I think at this time, it is all the more important to because we are socially distanced, and that can be very isolating. So just creating that environment in which you walk up to the workplace and you're able to smile at each other behind the masks and say a warm hi, that can go a very long way. And yes, knowing each other is important so we can tell when somebody is starting to struggle. I don't know if Dr. Toronto wants to say something more about it.
Yeah, I agree with you. I think that if we are able to be be mindful of our coworkers um, and ourselves, that we can be able to identify if something is amiss early on, and then maybe act on it accordingly.
We have another question here. How do you deal with hearing a coworker's consistent response of them being okay when asked if everything is all right, but you can tell that everything is not?
Is that for me? Okay. That is a good question. Um, as I've said a while ago, that there are certain people that is not able to acknowledge that they are stressed, number one, or they acknowledge that they are stressed but not able to accept that they need help. And that's why, as a coworker, you know, um, you could probably talk about what are the things that you observe that are different, and just assure them that if they need anything, that you're there to listen and to help. Um, Again, what you don't want to do is make judgment right away. Like, I noticed that you're not smiling a lot. Are you depressed? So avoid making those conclusions and judgment. So what I would do is, I noticed that you've not at the usual smiley self, or you've not been cheerful as usual. Is there something going on? And if they are in complete denial of something, then you can say, I just want you to know that that I care about you, and I'm here if you need somebody to talk to listen, or if you need any help. I think that slowly giving constant reassurance to the person would eventually make him or her think that it is safe for her to talk about what he or she is feeling. Because Dr. Kudir also mentioned about the stigma, because not everyone really wants to talk about their emotional and mental health in the workplace.
Absolutely. I think that's very helpful. And as you said, just being available and making sure that they know that you are ready to listen whenever they are ready to talk is important. And also, if just giving that impression and a feeling of being supportive, I think can go a long way in encouraging them to open up to you whenever they're ready. But you're right, you cannot force people when they're not ready to accept help. They have to. It is a process for them as well, and there's a lot of factors going into it. They don't want to share their stress with their coworkers. They don't want to burden you with their stress. They are worried about how it's going to look like for them as an employee to the organization if they're not 100%. So there's a lot of complicated factors that go into them not being able to talk to their coworkers. But I think just being available and ready and listening it can go a long way. I think we do have another question. When is it appropriate to inform a manager of your concerns, even though the person claims that they are okay?
So the question is it appropriate for somebody to tell the manager of your concern about a coworker, even though they don't feel like they need help?
Mm-hmm.
Um, for me, as I've said, if you're noticing any changes that is you're slowly thinking that it's significant, and that you are concerned about, I think that it is better to talk to the person first, and then if you see that it's really affecting the job, then you can speak with your manager, um, so that maybe the manager can can see if he or she can reach out to the other staff or to your co-employee about providing him objective reasons why the manager thinks that something is going on. Because remember, like when a person is having the chronic stress, their performance is affected. They don't come to work, or if they come to work, they're usually absent-minded or they're not able to focus well. So I guess with the manager doing that more objective approach in terms of like, I noticed that you've not been coming to work on time. I've noticed that from being very productive, your work has been, less than what I know you can do. They can probably, facilitate whether, the person might be more comfortable talking openly about what is going on.
Yeah, can I add to that? Yeah, because I think it's a very interesting, it's a very good question, and I totally agree with your response, Dr. Turner. I think here is the role of the supervisor. If the supervisor is a person that is open and is reachable, is easy to connect and communicate, perhaps even the supervisor may have noticed some changes. The idea here is not for a person to feel punished. It's not a punitive. It should not be. It should be to empower and to help a person to be able to see things differently and see if that, because we also want to make sure if someone is not doing well, they're not doing well at home, they're not doing well at work, it's hindering themselves, it's hindering the relationship with others, it hinders everything. So I think we want to be able to support our colleagues. But whether, so here we need to protect confidentiality, privacy. The hope is that it is the supervisor that hopefully can be able to address that, but you would want, I think I agree with you that you want to talk to your colleagues about your concerns in a more open and non-judgmental, or concerns sometimes is that we feel judged, we feel attacked, and then depending on the connection that we have with our people, then it affects that. I know people lost friends because they are not comfortable how the friends are talking to them, and the friend meant well, so these things have to be taken into consideration. But as you see, this is a very, very interesting and fascinating topic because, as I mentioned before, we spend a lot of time at work, and I think our mental health definitely matters. So, thank you.
Absolutely. Thank you so much. One last thing for the same question. If there are any concerns for the safety for the person that you're working with, like if they are talking about not wanting to live anymore, or there is a concern for their safety, then it's absolutely appropriate to go ahead and get help for them, because that's a point where we definitely have clarity in what needs to be done. But outside of that, I think just building rapport, as Dr. Caetano was saying, being open is helpful.
Thank you, Dr. Kadir. I think that's a really important point to add.
Mm-hmm. If they're in danger to themselves and others, that is our responsibility to report. I totally agree with you. Yes, thank you. I guess there's another question.
Let me see.
No.
Dr. Ubain, I'm sorry, your message disappeared. Did you say that someone was going to give regards for Nurse Thomas? Dr. Ubain? Okay. I just unmuted your Nurse Ellis. Okay. All right, let me try to unmute her.
Hi.
Nurse Ellis?
Hey, good afternoon.
Good afternoon.
Good afternoon.
I must say I'm just giving the greetings on behalf of Sister Sylvester, who's out.
Okay.
Very excellent presentation. I know as a manager, I take away a lot of tips from it, which we will certainly use in the workplace. I know we have a few staff who are here also are listening in, and I know they for sure too would have taken away a few tips from it. I know a lot of us, we in the workplace, we don't do deep breathing as much as possible. I think that helps. And thank you again. Very good presentation, Dr. Turner and Dr. Kader.
Yeah, thank you. Thank you. It's much appreciated.
Yeah, and we look forward to the other upcoming presentation that will be forthcoming.
Okay, so I think we'll end there. I want to give another thanks to our presenters, to our colleagues in BVI for helping us to coordinate this and to make this happen, and a big thanks to all of our participants who joined us today. Reminder you can help us improve these webinars by completing the survey that you're going to receive shortly. And we will be sure to share the recording with you as well as a copy of the presentations. So thank you again and have a wonderful rest of your afternoon.
Thank you.
Thank you.
Thank you. Bye.
Thank you. Bye.